The Hong Kong Institute of Diabetes and Obesity was established in 2005 under the Chinese University of Hong Kong, with a mission to prevent, control, and cure diabetes and its comorbidities. Through innovative initiatives and professional education, the Institute aspires to translate basic sciences and clinical research into the enhancement of human health and holistic capacity. From a small unit to an education and research institute, the CUHK Diabetes Research Team has taken a road that is less traveled. With Professor Clive Cockram joining the Faculty of Medicine in the early 1980s and becoming the founder of the Metabolic Investigation Unit in 1985, diabetes research at CUHK began to flourish. Later on, Professor Juliana Chan became a core member of the unit in 1989 after she relocated back to Hong Kong from her medical training. Diabetes research was new to Asia at that time. Despite the fact that many people in Hong Kong were diagnosed with diabetes and its complications at a younger age or with normal body weight, it was with very limited resources that only 4 physicians and nurses embarked on their journey of diabetes research and care at this initial stage. But the passion for a community without diabetes keeps them going. To achieve this common goal, and in response to this global health and societal challenge, the CUHK Diabetes Research Team believes that the formation of the Hong Kong Institute of Diabetes and Obesity is vital to address unmet needs, define questions, and formulate solutions through capacity building and concerted efforts with the support of the university.
Since our research transcends many disciplines, involving many collaborators and partners, both inside and outside CU, in 2005 we were recommended by our Vice-Chancellor to set up an institute in order to further promote interfaculty and also interinstitutional research through private-public partnerships. The primary function of the institute is to organize our annual Diabetes East-West Symposium. Recently, we were awarded a large research grant to study the genetics of diabetes and its complications. And the Institute have to support this program by organizing academic exchanges and also international scientific advisory boards. We need research to answer questions, education to train people, and enterprises to translate that knowledge into products and services in order to prevent, control, and cure diabetes.
The clinician scientists at the Institute work closely with researchers and care professionals from different disciplines to use cohorts, databases, and biobanks to unravel the complexity of diabetes and its complications. Based on these discoveries, the team has set up the platform to study beta cell biology and novel compounds in pursuit of a cure for diabetes.
Our research programs start with patients and end with patients. Over the years, we have combined research and services to set up cohorts, databases, and biobanks to understand the clinical progress, particularly the relationship between clinical and genetic profiles, as well as the effects of interventions on outcome. Our next step is to understand the effects of genetic variants on this human biology, and then how to use novel treatments to change that biology in order to cure diabetes.
Genetics is already helping us to prevent and treat diabetes in many different ways. So for example, if an individual knows he or she is at high risk of developing diabetes, that may actually help identify that person so that doctors could actually try to bring in interventions and prevention earlier. So a lot of these new genes that have been found to be associated with diabetes are giving us new leads into developing new treatments to prevent diabetes. Genetics advances is really helping us to both prevent and hopefully also treat diabetes in the bigger context.
Thanks to the support of the Research Grants Council, the university, as well as the industry, and the generosity of donors, the CUHK Diabetes Research Team has over the years received over 130 grants and donations of 370 million Hong Kong dollars for its research and services, including the recent theme-based research project on an integrated transomics approach to diabetic cardiorenal complications.
The major healthcare burden associated with diabetes actually lies with the problem of complications caused by diabetes, for example, heart disease and kidney disease. However, we currently are not very good at predicting which people are at risk of developing these complications, and also we have a rather limited toolbox in terms of treatments that can help prevent these complications. So our theme-based project is specifically aimed at addressing these needs. What we're trying to do is to use state-of-the-art genomic technology to try to identify what we call biomarkers, or in other words, labels, which will tell us which are the people at high risk of developing these complications in future. Our current theme-based research project is possible thanks to the hard work of many doctors and nurses who have developed a registry from all our diabetes patients and also collected with stored samples. We hope to advance further this resource in our theme-based research project by developing a multi-center Hong Kong diabetes biobank.
Knowledge transfer and people development are the core values of the Institute. Since its inception, the Institute has nurtured over 600 graduates through its 6 academic programs at CUHK with quotable qualifications of the Medical Council of Hong Kong and academic accreditations of various professional institutions.
It's very useful for the daily practice, including the acute disease management and also the behavioral modification of some disease risk factor, as well as the chronic disease control and care. And finally, also is very useful for the prevention of diabetes.
The course participants come from other health professionals like doctors and also allied health colleagues. It is very valid and very nice for me to learn the multidisciplinary approach from all these health professionals.
The reason I applied for the course is that as a dietitian working in the public hospital, we are seeing patients with diabetes every single day, and I think it's our obligation to keep updated to the latest advance of DM management.
We hope our graduates to acquire the latest knowledge in the field of diabetes, obesity and endocrinology, and that they can recognize the enormous healthcare challenges and opportunities ahead of us. And that's by using our complementary expertise, we can protect the health of these high-risk individuals, while at the same time, they can grow personally and also professionally.
The CUHK Diabetes Research Team also aspires to build a worldwide network through its annual Diabetes Conference and structured academic exchanges. Over 13,000 delegates from all over the world have gathered together for intellectual dialogues for the past 17 editions of the Diabetes and Cardiovascular Risk Factors East Meets West Symposium in Hong Kong. And over 400 doctors and nurses from different provinces of China have participated in a 2-week intensive training to address the pluralistic needs of people with or at risk of diabetes and its complications.
这个课程呢设计得非常的完善全面，就是让我们呢就是不光是学习糖尿病的教育和管理，同时呢了解了就是香港的医疗的体制和一些体系，比如说我们公立医院、私立医院，还有就是说我们一些就是社会支持的组织，比如说我们的社会福康组织，还有我们的就是香港糖尿联会，都让我们在这个整个课程当中有所熟悉和了解。
我学到的一些在我们医院就是有帮助的，就是一个糖尿病教育方面，就是专科护士的一个教育方面，要去全面系统的评估患者，就是他就是所有的一些情况，不光是单纯的给他进行一个教育，要了解一下他的家庭啊，还有就是一些人际关系方面的这些。
The Yao Chung Kit Diabetes Center was made possible through a generous donation from the Yao Yu Sai Education and Charitable Memorial Fund to the Institute and the University to increase the accessibility, affordability, and sustainability in providing risk stratification programs to the growing population of patients with diabetes in the community. Being the first university-affiliated diabetes center led by nurses, the center has benefited over 15,000 people with or at risk of having diabetes through its evidence-based comprehensive assessment services and education programs to complement medical care in the community.
The diabetes complication screening is actually different from a standard body check in a sense that it is really targeted at the evaluation of the diabetic patient in terms of their control, and also in terms of whether the risk factors are controlled well, particularly their blood pressure, their lipid profile, and also their body weight. In addition to these risk factors, we also like to actually evaluate for their complications, particularly complications involving the eye. We will actually perform a retinal examination, and we also do a urine evaluation to look for any evidence of diabetic nephropathy, diabetes affecting the kidney, and also examination of the lower limbs to rule out any diabetes affecting the nervous system and also the vasculature as well. Within the JADE portal, we actually have a lot of risk equations inbuilt into the portal, and that can actually evaluate whether this patient is of low risk, medium risk, or of high risk. And this actually would be a great benefit of raising the awareness of the patient of whether they are well controlled or not. And also for the doctor in charge, this would actually be a good triage system, whether this patient needs to be seen by a specialist or they can be of low risk and can be followed up by the primary care physician.
It is through seeing patients on a regular basis that we start to recognize what are the areas of unmet needs and what are the challenges in treating and managing these patients with young onset diabetes. A lot of these patients may have high cholesterol or high blood pressure, but there are currently no guidelines as to whether how aggressively we should be treating these other metabolic parameters in these younger patients. Of course, we have young females in their reproductive age who have diabetes, and there are concerns about some of these drugs being teratogenic, and again there are very little guidelines, and I think this would be an area that we should be looking at in the future.
The Institute and its center, along with 4 other sister units at CUHK and its teaching hospital, Prince of Wales Hospital, have been designated as the CUHK PWH International Diabetes Federation Center of Education since 2011.
Well, can I say first of all how much we admire in IDF the fantastic work that you do, both personally, Juliana, and also your institute. It fulfills a vital role, and I think that the value of its work is informed by its connections with research, with clinical practice, and with other stakeholders in diabetes. And we always look with interest to the research work that you publish and how it actually improves care for people with diabetes. As you know, our mission is to improve the lives of people with diabetes, and it is advances in research and the translation of that research into the practice of care of people with diabetes that makes a real difference.
The Hong Kong Institute of Diabetes and Obesity would not have achieved so much without the unwavering support of the university, generosity of its donors, and commitment of the diabetes research team. Celebrating its 10th anniversary this year, the Institute would like to reiterate their heartfelt gratitude to its many supporters for their years of stellar roles in joining the Institute for this meaningful cause to touch on the lives of many people with or at risk of diabetes and its complications.
The Institute of Diabetes and Obesity has achieved enormous things in the past 10 years, and I know that it's going to achieve fantastic things in the next 10 years. So if next year you're having a birthday party and you invite me and I'm able to come, I'll be back again.
I really appreciate the opportunity to say happy birthday to the Hong Kong Institute of Diabetes and Obesity. The people in Hong Kong should celebrate loudly and happily on their 10th birthday, but that the rest of the world should also celebrate because we benefit from it.
I'm happy to know that it's the 10 years anniversary of your institute. Hong Kong IDO, happy 10th anniversary.
Wishing you all the success in the coming anniversary on 20th, 30th, and so on. Hong Kong IDO, happy birthday.
Congratulations to the 10th anniversary of Hong Kong IDO. I wish the Institute all the best in the coming future. Happy birthday.